Okay, so for our health professional assignment, we're going to be talking about dental assistants. Chantalle, Dani, Kaitlyn, and Lyndsey are all in this group. So what is a dental assistant? A dental assistant is a dental health professional who works closely with or under the supervision of a dentist. They work with patients by performing tasks before and after the dentist meets with the patient, as well as during certain dental procedures. So there's two levels of dental assistant. There's a level one. Basically, level one is more of a chairside assistant, which means they prepare and seat patients. Other duties they may perform include charting patient information, sterilizing instrumentation, preparing dental materials and cements, assisting with dental procedures and processing any mounting radiographs. They also help pour and trim up cast models, and provide patient education and post-op instructions, as well as maintaining and ordering dental supplies. So a level 2 dental assistant needs additional training of intraoral duties, which basically means that they can do everything a level 1 dental assistant can, and more. So basically they can do the dental radiographs, they can do polishing, placement and removal of the rubber dams, take impressions for study models. They can do topical application of anti-carcinogenic agents. They can give oral hygiene instructions with an intraoral component. They can do the dietary counseling. They can apply materials topically or prepare the tooth surface for like a pit and fissure sealant. They can do applications of pit and fissure sealants, topical anesthetic, desensitizing agents, or like a whitening. There also is an option of level 2 duties, which also include polishing restorations and oral irrigation. So basically, some of the skills that cannot perform by a level 2 dental assistant in Ontario at this time would be the application of a mattress or wedge, or application of treatment liners.
The primary objective of Canadian healthcare policies is to protect, promote, and restore the physical and mental well-being of residents of Canada, and to facilitate reasonable access to health services without financial or other barriers. And according to the Canada Health Act, some surgical dental services, such as oral and maxillofacial surgery that would normally be performed in a hospital, root resection, apical curettage procedures when performed in association with other insured dental procedures, and dental extractions when performed in a hospital for the safety of high-risk patients if prior approval is obtained, is covered under the Canada Health Act. Since dental care is not covered under a federal or provincial health insurance plan in Ontario, it does not meet the comprehensiveness principle of the CHA. Some dental care is considered medically necessary according to the CHA, since some dental care maintains health, prevents disease, and treats injury and illness.
So the expected salary for a dental assistant, it ranges from $38,000 to $48,000. So starting out, it's about $16 an hour. And if you have 5 or more years of experience, you could earn up to $25 an hour. The salary also depends like how much experience you have and the location of where you are. So if you're in like a rural area, you'll probably get paid less. And if you want to move up in the field to become a dental hygienist, you'll have to go back to school and take more classes.
So funding mechanisms available to Canadians when they seek out treatment from a dental assistant, which would be at a dental office through a dentist. The majority of people would pay out of pocket, but you can also pay through your private insurance. You can either pay for that privately yourself or through an employer. The coverage varies depending on what insurance company you're with and what policy you have. There's also a non-insured health benefits program, which is available for First Nations people and their children under 18 months, but you have to be a registered First Nations person and be recognized by the Government of Canada to be covered through this program. There's other government programs all over the country. For example, in the region of Peel, there's a seniors dental program for those who qualify, so they can get dental care performed at a much lower rate. There's also a dental public health services of Prince Edward Island, which is for children between ages 3 and 17, and that's only for families who qualify.
So the short-term and long-term expectation of a dental assistant. So right now, dental assistants are in high demand. Dental assistants increase the efficiency of the dentist and dental office. Therefore, dental assistants have a safe option for securing future employment. Over the past 10 years, the number of dental assistants has grown to 6.1%. And in 2020, the expectation points towards moderate growth for dental assisting jobs, relatively steady over long term.
So the dental assisting regulatory authorities. For British Columbia, it is the College of Dental Surgeons of British Columbia. Alberta is the College of Alberta Dental Assistants. Saskatchewan is Saskatchewan Dental Assistants Association. Manitoba is Manitoba Dental Association. Nova Scotia is the Provincial Dental Board of Nova Scotia. PEI is the Dental Council of PEI. Newfoundland Labrador is Newfoundland Dental Board. The Yukon Territories is Government of Yukon Territories, a licensing officer. In the National Health and Welfare. Ontario and Quebec, there's no regulation. In New Brunswick, it is the New Brunswick Dental Society. So educational requirements to become a dental assistant include a high school diploma, preferably with knowledge in science-based courses such as biology and chemistry. They're required upon acceptance to dental assistant programs. Some dental assistant programs also require a CPR Level C certificate, and dental assistants receive their education through community colleges, technical institutes, universities, or dental schools. And graduates receive a certificate upon completion. And to become a certified Level 2 dental assistant, successful completion of the dental assistant board exam is required.